And we're back. Back with me today is Dr. Latashia Hicks, family physician for over 10 years, who's now working with bioidentical hormones and hormone optimization for both men and women. Welcome back, Dr. Hicks.
Thank you so much for having me. I'm glad to be back.
It's always my pleasure. I love how you talk about how you meet your patients and how empathetic you are to what they need and what their needs are.
Yes.
And I love that about you. I just want to give you a little shout out on that. And I'd love to talk to you today about hair loss, because it's something that is not talked about, but it's a very obvious thing when we're out in public. And I think that a lot of people feel a lot of shame. They feel like they shouldn't feel so badly about hair loss.
Mm-hmm. It's a lot that goes into that. It's a lot of emotion surrounding hair loss for men and women. I've seen it both ways. You know, there are young men who start losing their hair in their 20s, and women whose hair starts thinning for different reasons, whether it be hormonal changes, thyroid issues, having a baby. A lot of times young women experience hair loss and hair shedding after having their children. And it's so much already going on with your body changing, and then also now you have to deal with that too. So it can be very emotionally distressing for people.
So I do want to talk about the hormonal implication there as well, but I would love just to hear about the reasons. I think people frequently just say, why? Why am I losing hair?
Right. So some parts of it can run in families. So there are some people, men and women, who have patterns of hair loss that you find throughout the family. You know, the women in the family may lose hair. Typically, you may see the hair loss here in the temples, or you may see it in the crown of the head, which is like more of a male pattern. Also, with some women, they may experience it depending on what type of hair options they are using, such as wigs and things that may be putting traction on their hair and causing the hair follicles to pull. So that's another way. Also, thyroid issues. If your person's thyroid is too low or sometimes even too high, you can see hair shedding. And just sometimes it comes along with age as well. And then there are people who take their testosterone and their body converts it into another molecule in their peripheral tissues like skin and hair, so that they will start to develop hair loss as well in their scalp. Sometimes they may even develop like a woman that develops hair on the upper lip or underneath the chin and things like that.
Well, I'd love to talk about that since you're a hormone specialist. So let's focus on that for hair loss for a minute, about how does that hormone testosterone conversion work, or what can people do in that space?
Yes, so there's a lot that can be done actually. There are different serums that we can put topically. Also, I have access to a therapy that is with infrared light that helps to stimulate the hair follicles to regrow. I also have access to a hair replacement specialist who I partner with for my patients who need something while we're regrowing your hair and working on your hormones and optimizing everything. If you need a hair prosthesis or something else to help cover the areas that are causing you distress, we have options for that too, that can have you looking like you're 25 again.
That's amazing. So you're doing that. You're having people come to see you. You help them optimize their hair growth options while they can then see your specialist that you partner with, who can help you kind of cover that up while you're having that regrowth occur.
Yes.
Is that right?
Yes.
I want to take a moment to say thank you for your conscientiousness and care that you are providing for your patients. A lot of people don't do that. Think of how are we going to get you from point A to point B. There's a big space in the middle sometimes,
Yes.
especially when it comes to hair loss, because that can take a while.
Right.
How long on average are you seeing that taking for people to have regrowth with one of your methods?
So sometimes it can take a few weeks. When you first start having the hair growth, you may not notice it because they're little baby hairs and they're growing, they're coming in and they're little tiny little hair follicles and they're coming on up. They may look like little peach fuzz at first, and then it starts to develop, into the grown hair like what we're used to. And sometimes you can find that we're restoring the hair back into those areas that you have been worried about and troubled about, and now the hair is fuller. I've had patients that have actually come to me and and I have treated their hormones, gotten everything optimized, and saw the hair just flourish. So it was something they may have been distressed about at first, but now they are doing well. Hair is fuller. Their hairstylists and barbers are just, enthused about what they're seeing.
That's wonderful. So do you find that, I just want to focus on women for a minute. I know we focus on men with hair loss and have for so long. So I really want to focus on women because we are seeing it a lot more, especially with hormonal imbalances at younger ages, things like PCOS and other issues where we're seeing those imbalances. What specifically are you giving them or doing? Is it, because it's not all just testosterone here in this space. So what is it that you're looking at and doing?
You want me to tell my secret?
I want your secret sauce right now.
Well, so one of the things that can be done is there is a medication that is a very common medication. Is used for other indications as well. But this medication actually provides a blockade of that conversion of testosterone in the peripheral tissues. It's literally like a little pill that you take every day. It will block your body from taking your testosterone and turn it into DHT in your hair follicles, so that then once that stops, now the hair follicles can recover, and they are there, but the DHT is causing it to not grow appropriately. So once you block that, the hair will start to just come back.
Okay, perfectly safe medication?
Perfectly safe
We don't
medication.
have to share the name of it. I don't want anyone to go out of line and go from there. They can come see you if they want to learn about this.
Right.
So perfectly safe. And how long after starting to take this medication are people finding results?
You should start to see results in just a few weeks of the hair
baby
growth.
hairs.
The baby hair starting to come back, and then next thing you know, you start to take your pictures and looking, and you start to just see the fullness coming back as well. Also, we have topicals as well that you can put on, things that contain minoxidil, which a lot of people remember as the original Rogaine. I don't know if you all remember Rogaine, but the active ingredient Rogaine, we also have options that have that. That helps the hair to regrow as well. So we're basically hitting it from internal as well as external. So external will be the topicals, putting things directly on there, infrared light. But then with the other medication that I was talking about, it's from internal to out.
Okay, and so when people have this testosterone turning into DHT and you're doing that blockade, what else with this testosterone in that pathway? Is there anything else we should be thinking about when it comes to these patients coming in? Like, is there anything lifestyle-wise that is helpful for them as well, or anything that you add into that space?
Well, one of the things that we do as well is to optimize your nutrients, as well as iron. A lot of people do not realize that iron deficiency actually causes hair loss. So for women that are anemic or have heavy cycles and they've been losing all of the iron over the years, they are wondering, why is my hair thinning? That can be something as well. B12 levels, all of these other things. Also, there's something that I help to give my patients. It's a certain supplement that I sell on my vitamin shop, and it's called Methyl Factors. But this particular one, it has a methylated folate in it, as well as a B complex. And a lot of times people don't realize that the inflammation in their bodies are unable to fully recover. And sometimes when you put the methylated folate in, now your body is able to efficiently deal with inflammation, and that also helps.
That's great. And I think what the audience needs to hear, because you've heard methylation here a lot on the New Health, and when we think of methylation, think of it as an active form of a vitamin, so your body doesn't have to work as hard to make that vitamin do its job.
Yes.
And so that's why it's so beneficial. I love that you also have multi-factors in it, because a lot of people will use just methylfolate or just methylated B12, but what that can do is it can cause like a traffic jam in your system, because you don't have a little bit of all of those vitamins and nutrients that you need in order to have those building blocks to be able to recover
So
in
this
way.
particular vitamin, it actually has all of it all in one. So it makes it so much easier.
That's great. And that's, nobody wants to take more than they have to.
Yes.
So just taking that one is wonderful.
Exactly. So I have had patients that say, I don't want to take a lot of pills. They're trying to do it as natural as possible with as little intervention as possible. So I do like to have vitamins that have multiple uses, where we can minimize all of the pill taking.
I think that's great.
It can be distressing for people.
Yeah, especially when it's a vitamin, when it's combined and all put together in one capsule.
Yes.
So helpful. It's just one once a day?
Yes. Well, that one you can actually take 3 a day. You can
Okay.
take up to 3 a day. So you can start with 1 a day, and you can take up to 3 a day, and they can be taken all at the same time. So you don't have to take them all
Okay.
throughout the day where it's interrupting your day. They
For
can
me,
be taken.
yeah, I can take things once a day. I'm good. Twice
Yes.
a day, I'm hit and miss. 3 times a day, I'm throwing the whole batch out.
Exactly.
It's just not even
exactly.
gonna
So I
happen
try
for
to
me.
make it as easy and as efficient as possible for people,
No, that's-
because a lot of my patients are busy professionals.
Yes, absolutely. Yeah. So, well, thank you so much again for coming and for joining us today. You'll join us again next week.
Yes, I will be back.
Okay, please let everyone know what you're working on right now and how they can find you.
Okay, so right now we have so many wonderful things we're working on. We have specialized programs for hormone optimization, as well as hair loss solutions that we are working on. Some new and innovative things that are coming that I think you all would really be excited about. You can find me on the web at www.exceptionalcareelite.com. Again, that's www.exceptionalcareelite.com. On Instagram at xcareelite, that's EXCAREELITE. And you can call the office at 713-659-9309. We would love to talk to you and to help to guide you in whatever decisions that you would like to make for your optimal health and living your best life.
Thank you so much again. We'll see you next week.
Yes.
And thank you for watching as well. Come back after these messages for our next guest.